Right. Good morning, everybody. Happy Friday. As we're pulling up the content here, um, I've kind of got two objectives for my little spiel this morning. One is I wanted to just broadly talk about some of the things that we're getting asked about day in and day out from our clients when it comes to COB, to payment integrity, but really generally to sort of claims quality. And then second, what I try to do is to make sure I'm really bringing it home to what is relevant to this group day in and day out. So when we think about the types of tools that we're seeing deployed, the types of processes we're seeing improved, the types of skills that are important for practitioners like yourselves, what are those things and how do we see our clients trying to incorporate those each and every day? I'm sticking to that theme of better together. And what does it mean in terms of better together, not just with this group, and how can you all work better together in very specific use cases like coordination of benefits, but also how do our departments and our organizations work better together? The old sort of how does business work better with IT? And then how is the industry thinking about working better together? And so I want to sort of click down through each of those layers and explore a little bit of this theme and how I think it's relevant to the work that we do day in and day out. Before we get there, I've got just a couple of slides of grounding. The first, just a little bit about sort of COB or even just claims quality more generally. When I think about payment integrity or when I think about coordination of benefits, I think about what does it mean to sort of get to that far end of the bell curve, right? And so there is an investment made into improving claims accuracy, payment quality. At some point, there's some level of diminishing return where that investment starts to not have value at the tail end of the bell curve. And what we're really talking about here is what are those incremental efforts, right, where we can work better together, either having more accurate data together, more accurate collaboration to get that data to each other faster, or tools that allow for better collaboration so that we can kind of close that last end of the bell curve and sort of achieve that next level of, in our case, right, payment accuracy. This is not just about specific performance of our departments, though. Sheila and Robin both sort of alluded to this notion of what's really important is obviously getting our claims payments accurate and doing it timely. But what we're starting to hear a lot from our clients is that the business cases go beyond that. When I started working in claims 20 years ago and was working in claims ops, everything was like auto adjudication rate and accuracy. And every business case was administrative cost reduction. What we're really starting to see now is that even our operations clients, so our CEOs, our SVPs of ops, our VPs of claims operations, all of a sudden their business cases are more oriented towards that customer experience. So what does it mean to reduce provider abrasion? What does it mean to improve member experience? And so what we're starting to see is obviously on the right-hand side of the screen, we're still chasing that last couple of percents of COB. But there's additional opportunities that are really making the value case for further investment in claims quality. The $10 billion number, and if you do a quick Google search, you can find all sorts of research on claims quality, on administrative waste, on the cost of administering healthcare. This is a number that we came up with looking at a cross-section of our clients and trying to extrapolate the administrative cost of complexity in the system. In other words, how much does it cost the system when a member can't navigate to what the right insurance is, who should be making the payment, how do they help facilitate an interaction with their provider? And so it's a aggregation of sort of the number of calls they're making to the providers and to the insurers, the number of calls that providers are making to insurers. And it's a way to calculate, this is the opportunity if we can help to simplify the experience for the member and simplify what it means to be able to just get access to care without having to administer all the financial transactions on their own with regards to that care. And then to the far left is probably the most interesting stat that we've seen in the last couple of years with regards to claims ops or payer operations broadly, and that's every couple of years we run a survey and we try to target health insurance COOs or health insurance sort of executives in the ops space. And starting in like 2019, 2020, all of a sudden customer experience was like at the top of their priority list. It had never been there before. It was always, again, PM, how do we get administrative cost reduction? How do we improve automation? And over the last few years, this has either been at the top or tied at the top of the list in terms of not just your, sales, not just marketing, but actually the COO agenda. And so when we think about improving COB, when we think about improving claims quality, all of a sudden this notion of what does that mean to the provider experience, what does that mean to the member experience is starting to come into play. And so just as we sort of get into this notion of industry trends, think about this relative to, hey, what is the type of improvement that I'm trying to make, or my team's trying to make, or my department's trying to make. All of a sudden, it's really relevant to carry it all the way through to what does this mean to the member experience? What does it mean to their appreciation of the services that we all provide? So with that, Better Together. I'm going to start with Better Together at the industry level and kind of what we're seeing from an industry perspective in terms of trends towards collaboration, trends towards doing things in a way that allows us to facilitate across different players in the ecosystem. And so I just listed a few out here. I would imagine most folks sort of recognize all the names and terms on the page here. Generally speaking, I would say none of these are kind of solving world peace or world hunger yet, right? A lot of these terms have been out there, and a lot of the pushes towards getting more robust results, I think, are obviously really in their infancy. But it's important to understand because I think all of them are trying to trend towards this direction of what does it mean to have a more connected healthcare experience. And so we look at price transparency. I remember doing like systems integration work 15 years ago, doing like the first round of transparency tools where folks were trying to like do claims estimation for members, right? That sort of theme is still around, only now we're starting to see it from a regulatory perspective. We're starting to see mandates around transparency. Whether they're enforced or not, or how they're enforced, obviously is still a little bit nebulous. But there is certainly a trend towards what does it mean to provide an estimation of your liability? What does it mean to be able to provide, a SKU list like any other industry would do relative to the costs that are going to be bared by the member? And so when we think about that relative to claims quality, well, relative to COB, it's not just about the cost of the service. It's like, well, who is my primary insurer and how am I going to interact with them with regards to this service? How is transparency helping that process? Payer-provider collaborations. We're seeing obviously more and more collaborations, whether it's narrow networks, whether it's specific JVs where we're trying to point members to very specific points of care. All of those are going to need to make sure they have really robust controls that allow for us to direct the member in a certain way where we understand the financial implication of the choices those members make, right? And so when we think about coordination of benefits, we think about how we're steering members to certain points of care, and we're thinking about what are the implications to how that claim gets routed one way or another. It has a big implication on sort of what does that mean to the work that we all do. How do we think about how we're configuring the claim system to be able to handle those types of specific scenarios where we've got areas that we want these providers and payers to work together. CAA, so whether you're thinking the No Surprises Act or some of the other mandates coming out of CAA like machine-readable files, we have started to do a lot of work with our clients around just sort of establishing program offices to understand, all right, what does it mean? Not just what does it mean in terms of being able to like publish a machine-readable file that has all of the types of services we provide and some sort of price for those services, but actually, how do we even communicate what this means? So if folks actually wanted to pull these files down and use them, or if a member was in some way, really ambitious and started to try to look at some of these prices and try to understand what they mean towards that member's benefit, how do we talk about that with our members, with our providers, with our employer groups? And we've started to see a lot of our clients think about this, not just from a sort of IT, let's get the list out there, but really from a change management perspective, right? From a member engagement perspective. And how do we think about it relative to all of those players in the market? And then interoperability. So the promise of interoperability has been this notion of you carry your clinical data with you, right? So as a member, even if you move between health systems or you move between health insurers, you've got the ability to pull your medical information, your health record with you. But relative to COB, relative to payment integrity and claims processing, it also has the promise of being able to make sure that there is financial controls around how that information is moving, where liability for paying for certain services lies, and how payers can communicate with each other, right? And so when we think about what it means to get to that last edge of the bell curve, it's about getting to those last areas of COB processing, like, for example, pharmacy payment that I know you'll all be talking about today, to make sure that we've got the right connections, we're moving the right data in the right direction, to be able to make those determinations and get it kind of right the first time. And so these are some of the broad trends that we're just saying in the industry and how we're hearing our clients starting to organize around them. And again, I don't think any of them are necessarily moving the ball dramatically in any direction just yet, but the theme of working better together, getting data to the right place, getting it there accurately in a timely manner is certainly true across the board here. What does this mean to better together within our specific organizations? So one of the things that we are seeing quite a bit now is organizing differently around claims quality. So whether you're in an audit organization, a payment integrity organization, or just other continuous improvement teams, one of the things that our teams are doing a lot right now is helping claims operations think differently about using data, about doing root cause analysis when it comes to finding issues in claims departments, and then creating just an ongoing competency when it comes to driving quality improvement on an ongoing basis. At breakfast this morning, I was having a conversation with one of your colleagues in the room around how her organization has combined ops and IT, specifically in the claims space. And I think we're seeing a lot of that. We're seeing a lot of this idea where operations needs to have more ability to pull in the right tech, to pull in the right analytical skills, to pull in the right folks who understand how to manage claims data, not just in terms of adjudication and payment, but in terms of digging into quality issues, understanding what those quality issues really mean, and how we can potentially root cause them. And so kind of what you see here is just a very simple framework that talks about what a claims quality unit starts to look like. It's got your data and analytics team embedded. It's not just some part-time crew sitting in IT who on a project-by-project basis is helping out. It's a dedicated team who is really driving analytical improvement in claims quality. Quality management and focused on certain elements of the business. So again, coming to the sort of the pharmacy example, and we think about line of business, how are we making sure that we've got a specific focus, not just on the biggest employer group or the biggest market, but sort of across all the slices that we manage from a P&L perspective. Obviously, automation programs, probably don't need to spend a lot of time thinking about automation with this group. I'm sure it's a hot topic at all of your organizations. But then also, how do we think about quality operations sort of across all of the competencies in claims quality? So COB, payment integrity, audit. We're starting to see a lot more collaboration where we used to see a lot of just siloed organization, right? And so all of a sudden, payment integrity isn't just about managing the payment integrity vendors and making sure that we're getting some level of recovery. COB isn't just about making sure we're checking for EOBs coming in on claims or we're managing a relationship with someone like CAQH. It's about end-to-end quality. So how do we think about end-to-end quality at each organizations? Are you actually looking at what payment accuracy, financial accuracy is, and are all of these quality teams sort of marching to that same beat, trying to hit that same target for all of claims at the end of the day? And then better together, what does this really mean for each of you in the room? And how do we think about operating better together? So again, along that line of how we are seeing operations executives think differently about quality, the biggest thing that we hear from them is we need to get more quality claims analytics and technical skills embedded in what we do. And so you can just kind of see here, we hear a lot about how do we build technology competencies, how do we build quality competencies into our organizations. Historically, quality in the terms of like a COB config shop was all about how do we get the backlog down, how do we make sure we're getting the EOBs in. Now it's about how do we make sure we're getting the right data from an organization like CAQH, but we're using it in the most effective way we can, right? That we're creating a strong partnership where we know what we're getting, we know when to get it, we know how to use it, and we know how to track the results, not just in terms of our ability to get it in, but the results from a med expense perspective as well. And so when we think about the talent profile for folks like yourselves and what we're being asked is the talent profile of the future, this is what we start to talk about. You know, historically, we've seen claims organizations be very transaction focused, very specific to your particular claims platform. So whether you're on a Facets or a COBOL legacy system or Health Edge, having expertise in being able to process transactions on those types of systems. Very task oriented, right? Again, this notion of what is our AA rate, what is an individual processor's performance when it comes to resolving a particular type of pen or a particular type of adjustment. But what we're really starting to see even within operations, right, not just in IT, but in claims operations teams is this talent profile of the future, which is really about how do we start to orient towards what quality means from a technology perspective? How do we make sure we have the skills in claims where you all are thinking about the types of tools that could be brought to bear to improve quality over time? How do you bring the right skills to bear when you think about how do we look at the data, how do we examine data, how do we use visualization tools to find patterns in the data that allow us to get better at what we're doing day in and day out? And so we're starting to see this kind of future talent profile where some of that skill can maybe come from IT, but it's really coming from folks who understand the business and understand business processes in a very specific and very differentiated way to help drive to that last edge of the bell curve. And so what does that mean in terms of better together for the member? Well, obviously what this means in terms of better together for the member or even the provider is that the provider knows who to bill, the payer knows who to pay, and the member is really focused on access to care, right? Not having to pick up the phone and be their own sort of administrative machine for how to coordinate care, how to understand what the bill is, how to understand who to send the check to, et cetera. And so it's really about making sure we are improving quality, but again, coming back to that notion of doing it in tandem with thinking about the member journey and hitting that business case that now we all care about, which is improving that member experience over time. So there were a few things that I thought would be really important just to take away from these themes, and certainly not the only important things that are happening in the world, but things that if someone asked me, if I were working in a COB shop or I was working in a claims quality shop, what would I really care about, and what are our clients asking us to help them with? It's these three things. First, understand what it means to be able to use data-driven insights to drive collaboration. So there's some really easy examples of this, right? How are you understanding what payment integrity is sending into COB config, for example? Do you understand what that is? Do you understand when it happens? Do you understand the volumes and the impact of that? Do you understand the impact of the COB work that we're doing? So how to forecast MedEx avoidance with regards to COB, right? Do you understand the data and the impact of that data? Prepare for intelligent automation. So again, I assume everyone here has kind of been knee-deep in some automation project at some point in time, has seen your organization use RPA at some point. I do think we are going to see more intelligent automation, meaning for example, AI that reads claims coming in, sees the other insurance, and is able to apply it. I know folks are testing that out. I haven't seen it at scale, but this group of folks, this organization should understand what that's going to mean to your teams over time, and it's going to come quick. So I don't think it's something that's 4 or 5 years out. I've seen a few use cases where AI are reading provider contracts, they're reading claims that are coming in, they're starting to make decisions on how to load that to a system, and this group should be aware of the potential there and what it's going to mean for your teams. And then understand the impact of industry trends. So again, we talked about these 4 trends. We talked about the CAA, the No Surprises Act, pricing transparency. All of them are kind of like, moseying through the noise and trying to figure out how to make an impact. But it's going to be important, even if they are slow moving, even if CMS isn't enforcing the rules in a lot of ways, it's going to be important for everyone here to understand the impact, right? Understand what it means to your team when pricing transparency really does something. Understand what it might mean to your team if they actually do produce advanced EOBs and we're able to actually do some real predictive pricing on a claim for a member, and how does that potentially impact what's going on either in claims quality or in COB or in payment integrity, because theoretically it should help improve quality if the member understands who's liable, how to access care, and how to navigate through the healthcare system. And so with that, I would just say thanks. Have a wonderful symposium. I hope this was helpful and a good kickoff to your day. And we'll have contact information out. So if anybody ever wants to chat through any of these or has any questions, please don't hesitate to let me know.
Well, actually, I thought I would, while we have you here, ask a couple of questions. And I know I took a couple of notes prior to this, so I'm not to put you on the spot. But one of the questions I thought the crowd would be interested in asking, if they had the opportunity, what would you recommend to someone here that's, works in COB, like in day-to-day, and what should they focus on when it comes to, like, the key takeaways of your presentation today?
Yeah. So I think the first thing is if you're working in either a COB shop or a claim shop and you've got folks who are managing, COB, make sure you understand the impact of that, right? And what I mean by that is, do you have a PMPM forecast for COB? We talk about the value of the CAQH tool. We talk about the impact it can have, and you'll hear about that in the next couple sessions I saw on the agenda. But do you actually know what it means to do you understand what it means to realize value from the work that you do at a record level, right? When you find other insurance, do you equate that to a particular savings in medical spend? Do you equate that to some sort of administrative alleviation of pain? Make sure you really understand that, because, again, as we think about what it means to see data-driven insights come, see more robust analytical models coming, see more robust intelligent automation tools, it's all going to start with this group really understanding the impact of the work you do. And again, not just the performance of the ops team, right? Not just that, hey, we had 1,000 backlog, we got it down, or we're working really well with CAQH. Understanding the impact of that relative to the impact on the business, relative to the impact on financial and payment accuracy, for sure.
Okay, great. And one more question. Yeah. You mentioned technology, obviously, throughout. What, specific technology trends, do you think the audience should be thinking about?
Yeah. Of those four trends, I think interoperability is one that is going to be, if not most impactful, most relevant to this group. So if you haven't heard about, like, the FHIR standards, which are just a set of standards about how to transfer healthcare information back and forth, I would really recommend you just read up on it and understand it. The whole basis of it is about this notion of how do we more accurately, with better controls, share information. And so when we think about better together, we think about being able to make sure we've got the right information to use at the right time. Whether you sort of believe in the near-term vision and the horizons that some advocate for interoperability, I think the themes of them are really relevant. And that technology theme of being able to have APIs that allow different organizations within the healthcare ecosystem to communicate more effectively is just going to be really important for folks who work in this space. And whether your organization is one of those that's really gung-ho and developing all that, or one that's sort of a little more conservative and looking to see what others do first, the goals of something like interoperability are really relevant to this group. And so I just really recommend being able to make sure that you are fluent in what that vision is and how it's applicable to the departments that you all work in.
Okay, fantastic. Well, thank you, Mike, for...
Yeah, thank you. It's great.
I'll squeeze by
all
here
right.
so I can...
Thanks, Sheila. Thanks,
Sorry.
everybody. Appreciate it.
A little tight. Thank you. So I think we can all agree we have a better picture of what's happening in the payment integrity space and coordination of benefits. Lots of perspectives, that to consider from the presentation. And Mike will be around, so if there are questions in between sessions, we have a lunch break, please seek Mike out.